Hi, Dr. Haynes. Welcome to our video that we're making regarding our virtual neurotology interviews. Normally, we bring each resident in for a full-day visit. We want them to experience our operating rooms, our clinical areas, our culture, our who we are and where we live and where we work. Obviously, nothing's normal this year. We're doing these virtual interviews to try to capture that for you. We're obviously a very high-volume center. We're a high-volume cochlear implant center, high-volume skull-based center, high-volume chronic ear center, and we very, very much believe that the clinical competency is key to success for our fellows.
The skull-based cases are really special here. I think the kinds of cases that we do are very complex. And the kinds of approaches we do cover all three major routes to the posterior fossa. So to get training in all three approaches and to have robust exposure to all of them is also something that's quite rare among fellowships.
From someone who trained here to someone who's been here now for almost 17 years, by far the strength of this program is the diversity of the clinical cases and the people that are here. We get a significant amount of skull-based exposure to the point where there's often days where there's multiple cases going on and the fellows have to choose between which case they're going to cover.
It's being able to walk into a medical center the day after you finish and be able to operate with the best in the world. If you can do that, then all the other stuff will come along. We'll teach you as you go, operations and leadership, emotional intelligence, and all the other aspects of being a clinician and a physician and a person. But if you can't walk into a medical center and operate with the best people in that center, you really owe that to your patients and you owe that to yourself. And we will teach you that here. We will teach you how to operate with the best people in the world. Yeah, what I'm most proud of in the fellowship is the success of the people that we've trained.
This program is one of those really rare programs that's part of a unique tradition, a really long-standing tradition. The fellows that have come out of this place have occupied chairmanship positions all across the country.
There's a lot of collaborative efforts that go on here. And so really no matter what kind of thing you're interested in within our field, there's likely someone else who's interested in something similar or has a similar program already going who would be happy to work with you on that.
And the clinical research opportunities here are abundant thanks to the volume of cases we do and the skull-based database that we've been maintaining. We do 300 cochlear implants a year, and Renee Gifford, one of our research audiologists, who's also clinical, does a wealth of cochlear implant research and is extremely well known in the field. So the CI research here is really top-notch.
One of the strengths is just the amount of research that has been able to be produced over the last 10 years. We're constantly looking at our fellows to push that envelope, to develop an idea, and through the first 2 years of their fellowship, search out a niche within neurotology that they can become famous in nationwide. Because we'll all be good surgeons by training at a great program. What we want is to have leaders in this program.
My favorite part about training fellows is watching people develop into better surgeons and better clinicians than they were when they got here. And it can be really neat to see someone progress from not having a certain skill set to being able to do things sometimes even better than I could do myself. And seeing people develop their talents and their skills that way is probably one of the best things about being an attending in general.
I think that it's really gratifying to work with people who are highly motivated, who want to become better. It's inspiring because it makes me want to be the best teacher and the best surgeon and researcher I can be.
That our fellows are constantly making us better. They're introducing us to things that they've done before they got here, telling us about interesting research projects that we've never thought of. And that's how we advance science.
You know, all of our Otology Group fellows, the one thing that seems to really be a constant amongst all of them is they are all exceptionally hard workers and very accomplished individuals, and people who are very driven by a passion for advancing what we can do in the ear surgically, as well as what we know about the ear as a knowledge base.
And then, last but not least, the mentorship here is stellar. I think between David Haynes, Mark Bennett, all of the neurotology faculty, these are people who are really well respected in the field, who really care about the product that this fellowship makes.
We hope these videos can give you some idea of who we are and what makes us tick. So thank you for viewing the video, and look forward to seeing you on the virtual interview day.
Training fellows. I really, well, should I tell them a lie about you or not?
I moved my screening badge down here.
You look so pensive. Show us your good side. Anything else you want to say?
I hate Liz Perkins.
So I was talking about the weaknesses. Maybe we can start over there. What are the weaknesses, really? Why don't you tell me? Nothing.
The lack of mentorship.
Okay.